Okay, hi, I'm Dr. Ling, consultant pediatrician at Thomson Hospital, Kota Damansara in Malaysia. Okay, today we are going to talk about what we as parents can do for our child at home if he happens to be COVID positive. Okay, nowadays, as more and more adults are vaccinated against COVID, the proportion of children with COVID appears to be on the rise. This is in part due to the fact that children either have yet to take or are not eligible for the vaccine. For the past several weeks, several of my young patients have also come down with COVID. Hence, I feel the need to educate parents on what they can do at home for their children who are COVID positive. Our public and private hospitals are still overloaded with COVID patients, and there could be no choice but to monitor our COVID positive kids at home. Okay, here I will break down what we can do for our COVID positive children into 4 steps represented by the acronym IOTA, IOTA. Okay, step 1, isolate. Well, because children normally do not go out much, it is usually the parents or other adult family members who catch COVID first and passing on to the child. If the whole family has come down with COVID, then all can isolate together in the house. However, if there are family members who are still COVID negative, then arrangement to separate those positive from negative need to be carried out. Isolation can be done in a room with designated bathroom. How long does our child need to isolate? Okay, for 10 days, counting from the first day symptoms appear. If the child has no symptoms, then we can count 10 days from the day he first tested positive. Okay, step 2, observe. Observe for symptoms of COVID. Most of us are fairly familiar with COVID symptoms. They are the same in adults and children. The major symptoms include fever, sore throat, cough, and runny nose. Other minor symptoms are lethargy, body aches, dizziness, headaches, the infamous loss of smell and taste, diarrhea, vomiting, and abdominal pain. Most of the children with COVID infection would not have any symptoms, what we call asymptomatic. Some of them might develop symptoms. It is very important that we document the day the symptoms first appear. This is considered the first day of illness. COVID usually goes into the critical phase around the 6th to 10th day of illness. If our child were to deteriorate, it is usually during this period. This is the time we must observe our child closely. Step 3, treat. In the early stages of COVID infection, all our child needs is symptomatic treatment. For fever, sore throat, body aches or headaches, we can use paracetamol, while antihistamines can be used to treat runny nose. Make sure that our child continues to take in fluids to keep him well hydrated. So far, there has been no specific medication shown to be beneficial for children with COVID. Medications like ivermectin, hydroxychloroquine, favipiravir, interferon, and remdesivir are all not recommended. In fact, they may do more harm than good. Similarly, none of the supplements such as high-dose vitamin C or D can help our children who are COVID positive. Step 4, alarm. Alarm bells must start ringing if our child has any of the following warning signs. This is especially so during the critical phase from the 6th to 10th day of illness, though some signs may appear earlier. Okay, first alarm bell, he appears generally unwell. He's not wanting to play, run about, or watch his favorite YouTube or television channel. When a child is having fever, he might appear unwell, but once fever has settled with medications, he should not continue to be unwell and should almost be back to his usual self. Alarm bell number 2, poor oral intake, especially fluids. When a child is sick, he should still be taking in at least 2/3 of his usual fluid intake. It would be a concern if his fluid intake is less than that, particularly so if accompanied by poor urine output. Thirdly, breathlessness. We can time his breathing rate. Breathing in and out is 1 breath. For infants less than 1 year, anything more than 50 breaths per minute is fast. For toddlers between 1 and 4, the upper limit is 40 breaths per minute, while for those 5 years and above, the upper limit is 30 breaths per minute. Fourth alarm bell, a pulse oximeter reading of 94% or less. The pulse oximeter, placed on the finger, picks up the oxygen saturation in the blood. You can purchase the pulse oximeter from online stores. For bigger children, we can do the sitting-standing test. We measure the child's resting pulse oximeter reading, then get him to sit and stand repetitively for 1 minute and record his reading again after the exercise. A difference of more than 3 percentage points is significant. If our child develops any of these warning signs, it is time to get him admitted to the hospital. Do not attempt to continue treating him at home by providing him home oxygen therapy. He could need medications such as steroids that can reduce further lung damage and improve outcome. Okay, here you have it, the 4 steps in home monitoring: IOTA, isolate, observe, treat, and alarm. Also remember the 4 alarm bells or warning signs: child unwell, poor oral intake, breathlessness, and reduced pulse oximeter reading. The good news is, in most children, COVID infection does not become severe and will not have lung or organ system involvement. We hope we never need to see any of these warning signs appearing in our children who are COVID positive. Okay, that's it for this segment. Stay safe, take care, and continue to have a heart for kids.